Welcome to aminacademy.com. In human anatomy and physiology, let us discuss about diseases of lymph nodes. Splenomegaly. This is the enlargement of the spleen and is usually secondary to other conditions. Example, infections, circulatory disorders, blood diseases, malignant neoplasms. Infection. The spleen may be infected by blood-borne microbes or by local spread of infections. This red pulp becomes congested with blood and there is an accumulation of phagocytes and plasma cells. Acute infections are rare. Chronic infections. Some chronic non-pyogenic infection cause splenomegaly, but this is usually less severe than the case of acute infections. Circulatory, some primary infections include tuberculosis, typhoid fever, malaria, infectious non-nucleosis. Next one, circulatory disorders. Splenomegaly due to congestion of blood occurs when the flow of blood through your liver is impeded by fibrosis in liver cirrhosis. Blood disease. Splenomegaly may be caused by blood disorders. The spleen enlarges to deal with the extra workload associated with removing damaged, worn out the abnormal blood cells. Tumors. Benign and primary malignant tumors of the spleen are rare, but blood spread tumors fragment from elsewhere in the body may cause metastasis. Now we'll discuss further detail about disease of lymph nodes. Lymph nodes diseases also known as lymphadenopathy. Lymphadenopathy encompasses a wide range of conditions where the lymph nodes are abnormally enlarged or altered in consistency. These conditions can be caused by infections, autoimmune disorders, or cancers. Common cause is included infections like strep throats, the common cold, and mononucleosis, as well as autoimmune diseases like lupus and rheumatoid arthritis. Lymphoma, a cancer of the lymphatic system, is another significant cause of lymph node issues. The common conditions affecting lymph nodes: infections, viral, common cold, flu, mononucleosis, HIV, chickenpox, shingles, rubella. These are viral. Bacterial, strep throats, skin infections like cellulitis, tuberculosis, cat scratch diseases, Lyme disease, and syphilis. Fungal, parasitic, toxoplasmosis. Autoimmune disorders, lupus, rheumatoid arthritis, sarcoidosis. These are the autoimmune disorders. Cancers, lymphoma, Hodgkin and non-Hodgkin lymphoma, leukemia, acute and chronic lymphocytic leukemia, metastatic cancer, cancer that has spread from another area of the body. Other lymphatic disorders, lymphangitis, inflammation of lymph vessels, lymphoma, benign fluid-filled cysts under the skin. Cattleman diseases, the overgrowth of cells in the lymphatic system. Now, LAM, abnormal muscles-like cells growing in the lungs, lymph nodes, and kidneys. mesenteric lymphadenopathy, inflammation of lymph nodes in the abdomen, autoimmune lymphoproliferative syndrome, a rare genetic disorder with high lymphocyte count, lymphedema, swelling due to lymphatic system damage. Some system symptoms: swollen and sometimes painful lymph nodes, fever, flu-like symptoms, and night sweats, fatigue, unexplained weight loss, and excessive night sweats in lymphoma. Lymphomas related to the affected body part such as itching, difficulty moving, repeated skin infections, or skin changes in lymphedema. Diagnosis: physical examination and patient's history are crucial. Blood test, imaging techniques, ultrasound, MRI, CT scan, and lymph node biopsies may be necessary to determine the cause. In some cases, lymphoscintigram may be used to assess the lymphatic system's function. If we experience swollen lymph nodes that are persistent, painful, or accompanied by other concerning symptoms, it is essential to consult with the healthcare professionals for proper diagnosis and treatment. Disorders of the spleen. Look at here, these become spleen become enlarged. Spleen disorders encompasses a range of conditions that affect the spleen's functions, size, or structure. These can include infections, blood disorders, cancers, and other conditions that impact the spleen's ability to filter blood, store blood cells, and support the immune system. Diseases of thymus gland. The thymus gland, while small in adults, is crucial for immune system development, particularly T cell maturation. Disease affecting the thymus can lead to a range of issues, primarily impacting the immune system and potentially causing other related conditions. Tumors. There are two tumor types: benign tumor and malignant tumor. A tumor, also known as neoplasm, is an abnormal mass of tissue that can form when cells grow and divide more than they should do or don't die when they should. Tumors can be benign, that is cancerous, or malignant, cancerous. Malignant tumors can spread to other parts of the body, while benign tumors typically do not. So far, we discussed about some disease of lymph nodes. We have done. Please subscribe our YouTube channel.